Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, Tracy, if you or a loved one has a terminal illness, a life-threatening illness, and you've exhausted all the treatment options, another option that you might want to consider, hospice care. Now, unlike other medical care, the focus of hospice isn't to cure the underlying disease. The goal of hospice is to provide and support the highest quality of life possible for whatever time remains, and that's just what all of us would want for a loved one.
There is a myth that patients should be in their last days or hours of life before being ready to discuss hospice, but early referrals to hospice can help patients and their families benefit from many of the services that are eligible at the end of life. Here to discuss hospice care is Mayo Clinic Palliative Care Specialist, Dr. Jacob Strand. Welcome back to the program, Dr. Strand. It's great to see you.
Oh, delight to be here. Thanks for having me.
Thanks, Dr. Strand. So you are a palliative care specialist. Tell us what that means.
Yeah, so palliative medicine is a field, palliative medicine and palliative care is a field that's really sprung up over the last 15 to 20 years, at least for most patients and their families hearing about it. It's a medical subspecialty that really focuses on taking care of patients with serious illness. And when we say taking care, a lot of the things that you've already said, focusing on quality of life, so that might mean managing someone's pain during a cancer diagnosis. It might mean helping to treat their shortness of breath if they have emphysema or other lung problems. It also might mean helping patients to come to grips with what a serious illness means for themselves or their family members. And importantly, it works with a patient's other doctors to help provide the best care possible at any age or any stage of a diagnosis of a serious illness.
And that's the part that maybe people are confused by, is that working with all the physicians.
Right. Well, I hear a lot that sometimes from my colleagues, my physician colleagues, that a patient isn't ready for palliative care. And I think what that gets to is another myth, is that palliative care is somehow the same as hospice, which is somehow the same as end-of-life care. And I think what can be helpful to note is that palliative care is appropriate for anyone going through a serious illness, even for those patients who might have a curative illness that, just gives them a lot of pain or suffering as they're going through their treatments. And that job of ours is really to help a patient achieve the goals as they identify them for themselves and their families. You hear me saying a lot about serious illness when I talk about the world of palliative care, and that's because it's really not restricted to patients with a terminal illness. And I think that's an important distinction that more of our patients can benefit as we expand that definition.
So palliative care is sort of a general term, and then underneath that are the categories of hospice care and comfort care. Is that correct?
Yeah, so there's a lot of terms out there. So palliative care, I think it's important to note too that there are specialists who do palliative care like myself. So I work in the hospital and see patients at the request of other colleagues in the hospital. I also see patients in the clinic. There are some communities that have palliative care programs that are attached to home care programs, so sometimes patients come into contact that way. But it's really about what are the patients that may benefit for that. So that's palliative care as a specialty form, but actually a lot of people do palliative care. My surgical colleagues do palliative care. My cancer physicians do palliative care. They do palliative care in their work because what they're working on is helping to improve a patient's overall quality of life. Some patients benefit, actually all patients benefit from those basic skill sets, and some patients need a subspecialty skill set, which is one of the things that I provide. When we think about hospice, the way that I look at that realm is that it's a type of palliative care applied to patients who might have a more advanced form of an illness. So we often think in terms of a terminal illness. That's in large part because I think the question that comes up is, well, does my insurance cover that? And that's because it's really defined by Medicare. So hospice is really a form of palliative care that is meant for patients in the last 6 months of their life. So that definition becomes important because it's a certification. But I think it's also really critical is that most of us don't know what that means. So most of us don't have that crystal ball. And so it's not so clear cut. And so I think for patients who are worried that if I sign on to hospice care, all I've got is 6 months and then that's it. That's not so clear for us. We have many patients who have been on hospice for longer than 6 months because they've done so much better, and some patients who have a much shorter time on hospice because their illness is advancing so quickly. That other term you brought up is comfort care, and I think that gets brought up a lot in the hospital settings. And the way that I look at comfort care is anything that helps enhance a patient's comfort, period. We make it real simple. It doesn't have to mean things that are taken away from a patient or we're only doing X, Y, and Z. It's really what can we do as physicians, nurses, other caregivers to help provide comfort for that patient. And so a lot of patients who are getting hospice care are receiving comfort care, but they might also be getting antibiotics for a pneumonia that's making them uncomfortable. So I think some of it is it's definitions that we've made more complicated as healthcare providers. And so that's how I think about it, is in those more simple terms.
So in general, though, if you have to certify that, in your opinion, somebody qualifies for hospice if you expect them to live 6 months or less.
That's right.
But if they live longer, Medicare continues to pay.
Yeah, and that really gets to the role of the hospice team in figuring out what that patient's need is and what their need is going to be as their life continues. And so what it means is it's not we certify you for hospice and you never get seen again. The goal is that there is a team approach who follows that patient very closely, whether that's in the home or in another setting. And if that patient improves initially because they're getting extra help at home and they're getting extra care, that's fantastic. That's not actually a bad thing. If their overall disease, though, is continuing to worsen, and there are ways that physicians and nurses measure that, patients can stay on hospice beyond that initial 6-month period.
And who's on your team?
So a hospice team is really made up of a core group of nurses who are certified in hospice care, physicians say a hospice medical director. There's always a hospice medical director. And then maybe in big hospices, other physicians who do a lot of work in the home with patients. There are pharmacists who do a lot of work with medications to make sure that patients are getting the right medications for them to give them the best relief of their symptoms and the best quality of life. There are social workers who can help patients figure out some of the complicated financial arrangements that exist. You know, a lot of times I have patients who are trying to decide, what do I do with the family business now that I know my life is going to be shorter? What kind of wills do I need to have in place? What other arrangements should I make to take care of my family in these last months? And social workers can be really helpful with that. We also know that it's not just about the physical care or even the psychosocial support, but there's a lot of spiritual needs that patients ask for. And so chaplains are a really important part of a hospice team to help provide spiritual care.
You mentioned hospice center.
Yeah.
But now aren't more people going around the route that they can go to a hospice center, or you can hospice at home, or has that always been an option for patients?
That's a great question. Because so sometimes people think that hospice is a place, and hospice is, the way I look at it, is it's a service and it's an insurance benefit. So it's actually both. And that service can be brought to patients in any care setting. So many patients say they want to be at home, so hospice can come to your home. Many patients, though, that's really hard for them, or they don't want to be in their home in their last months of life, or they want to take the burden away from their family. And so there are skilled nursing facilities or nursing homes where hospices can provide care there too. People say, well, why do I need a hospice if I've also got a skilled nursing facility? And I think one of the pieces there is that the more eyes you can put on a patient, the hope is that we give them better care because we're all attending to different needs that they may have. There are also, you mentioned hospice facilities. So for some patients who don't want to be in a nursing home and they don't want to be at home, depending on what part of the country you're in, what part of the state you're in that area, there are sometimes residential hospice houses. And what that is really a more home-like environment where there are specially trained hospice nurses there 24/7. And that becomes important because a lot of people ask the question, well, if I get hospice involved, are they always going to be at my house? And sometimes they want that, and sometimes they want them out of their house.
Right.
And really, in its purest form, when it's at home, it's not hospices. The hospice isn't there 24/7, so that's what a residential facility would be.
So lots of options.
Yep.
And we're so grateful for you being here, and also the families that are touched by everything that you and your colleagues do. It's a wonderful thing. And thanks so much for being here to explain it to us. Palliative care specialist, Jacob Strand, thank you very much.
Thanks for having me.